Because neuroplasticity means that our brain, our nervous system, how we are set up, it's never set in stone. Plasticity means the ability of our brain to change itself in response to the environment that it lives in.
Right.
And it's a ticket talking Mazda for the biggest. That's a comma and a comma and a comma. Gotta get it.
And it's a ticket talking Mazda for the biggest. That's a comma.
Hi, Svetlana. Nice to see you again.
Hello, how are you?
Yes. We finally found the time, and I was so excited to talk to you. I think everyone here will find your story interesting. And before we get into it, would you like to introduce yourself?
Well, I'm Svetlana, and I'm a neuroplasticity therapist for young children who have some kind of neurodevelopmental challenges. Usually they're the kids who are diagnosed with autism or suspected, parents suspect that they might be autistic, and they have challenges with communication, emotions, behaviors, various difficulties when suddenly parents realize that something is not quite right and things are not on track and not as they were expecting or hoping. So I help these children, and I help the parents as well to feel better about themselves and feel that they're doing the right thing.
Yeah, and could you repeat the title again? Neuroplasticity?
Neuroplasticity therapist and parenting mentor.
So what makes neuroplasticity, for the audience that's not familiar with this, what makes this approach unique? Tell us a little bit more about that.
Well, the usual approach to this kind of issue is that as a mom, when you see that something is going on with your child that you don't understand, maybe your child doesn't respond to their name, or maybe they have meltdowns and you just feel like you're not coping, and maybe they have a language delay and they don't communicate their needs, and they don't seem to understand what's going on around them. So what usually happens, because as a society we like to diagnose people with something, parents go, oh, could my child be autistic? So they start the process of that, I'd say, like putting a child into a box and sticking a label on it, right? People seem to think that this is a permanent thing. Okay, so this is we are on the pathway, right? And it so happens that people then start putting the child deeper and deeper into that box. And I see things like people say, I'm an autism mom, and we're on autism journey. We are, you see different people on Instagram, their accounts, and they say, this is Journey's autism journey, or my name is something and I'm an autism mom. And it seems like it can't be just the child's journey. It can't be just the mom's journey. And it seems like this is like the main feature about that particular child and that particular family, that it just has to be somehow something to do with autism. But
like autism is brought to the forefront. It's like their whole identity now.
It becomes it becomes somebody's identity, right? But the children, they don't necessarily understand those things imposed on them by our society. They just want to be children, and it so happens that some things in their life are maybe hindered by some difficulties that they have. But what I don't believe in is in putting those restrictions on them, because what then happens is the expectations and hopes for the child change, right? Once
Right.
Parents,
once they're told that these are your restrictions, these are your limitations.
Yes, and they suddenly say, "Oh, but this child probably won't be able to ride a bike, probably won't be able to swim, or probably won't want to have friends, because don't all autistic children do this particular thing, and they like to be in their own world." But the neuroplasticity approach, I like it. That word always was on my mind. When I was one of those parents, I couldn't understand what was happening, what kind of difficulties my child had. Because neuroplasticity means that our brain, our nervous system, how we are set up, it's never set in stone. Plasticity means the ability of our brain to change itself in response to the environment that it lives in.
Right.
So I don't agree with this fatalist approach that the child has to be following a certain path, like that somebody prescribed to them.
Right.
I believe in looking what exactly are the struggles, what are the challenges, and why are they there? Okay, and then we can change the environment and help this particular child, their brain, their nervous system, because if we know how children develop, we can look at the developmental aspect, right? And I think I like it much better, because when you look at the label, diagnosis, if you noticed, there are various labels out there that all end with the word disorder, right? Autistic spectrum disorder, attention deficit hyperactivity disorder. What else is there? Developmental coordination disorder, obsessive compulsive disorder, generalized anxiety disorder. They're all disorders. But they are only disorders because we are a judgmental society, right? This is not what we expected, so it has to be a disorder, right? Instead of accepting the label, and again, I'm not a medical professional. I don't deal with the labels. I look at the child and see, okay, where is a struggle and what can we do about it? So if we look at the labels that all end with the word disorder, it's not very helpful, because, it is a disorder. What do you do with it, right?
Right.
But if you look at neurodevelopmental part of it, then you look at development, then you look how we can develop it. And that is very different, because it gives you, rather than fatalist, inevitable, permanent something, you can look at something that can change, that can be developed. And
an area that just needs a little bit more attention.
Yes, a little bit more attention, a little bit more help, and then we can look at, say, a child doesn't respond to their name, and I'm actually thinking about running a workshop on that for parents, because the usual answer, why does a child not respond to their name? The usual answer is what? Well, they might be autistic. Autistic children, it's normal for autism. They don't answer to what they hear, right? They don't respond to their name. What do you do with that answer as a parent?
Yeah.
You accept it. My child will never respond. That is inevitable. That's it, set in stone. But if you actually look beyond that, put that to one side and think about, what does a human, a child, needs to be able to answer the name. And they need to have a well-functioning, or at least adequately functioning auditory processing. And then if you look at that, you think, okay, what happens with auditory processing? Why in that particular person it's not functioning very well? And then it's a whole different world, because then you see something that you can work with.
Yeah, like reverse engineering it.
Yes, and you can go back and unravel that aspect, and then you find out that it is related with how our ears are set up, and that how our brain receives information, maybe not adequately, and which is why it can't then respond. So to me, it is much better because it gives answers and it gives solutions as to what we can do and how to improve that. And I have children who start responding to their name within weeks with the right approach.
And right? To me, it sounds like if you tell a parent your child is autistic, this is normal. They won't respond to their name or whatever else is normal, like you say.
Yes.
Then the parent also might be reluctant to even trying to even practicing that. Like your child won't ride a bike. So maybe they won't even try to teach their child to ride a bike because
exactly.
They've already put that restriction that, oh, my child will never ride a bike because they have, so.
Yes. And I sometimes go into Facebook groups and answer questions there. And for example, one of the things that is pops up quite often is a toddler doesn't want to walk. Maybe a 3-year-old, then it is a 4-year-old, doesn't want to walk outside, gets overwhelmed, and parents think, well, they've been diagnosed, so there is nothing I can do. I need to buy a bigger pushchair because they've outgrown the one that they had as a baby. So then, but how many pushchairs are you going to buy, right? The child is 3 years old. It can't walk because it gets overwhelmed with everything outside. And outgrown a pushchair, so we buy another one. And then they're 6 years old, they still don't want to do that. By then, the parents already accepted that this is how it is. My child is not going to walk happily outside, so I need to look at yet another pushchair and another. But at what point do we stop and try and see what can we do differently here? Why is that? But if the answer is because this is normal for autism, which is what people usually come up with, oh, that's normal. Yeah, mine doesn't do that either. Here is a model of a pushchair, right? There are all sorts of gadgets and equipment and everything marketed out there to make life easier. But to me, it is far easier to help a child and see what is happening and why are they overwhelmed. And it's usually to do with sensory processing. Once you help them with that, they don't feel so overwhelmed by the world around them because they can understand it better. And then there isn't so much of a problem for them to walk in an unfamiliar place. Right? So it is things like that if you look at it as a developmental issue rather than something that is determined and can't be changed, it can change lives for these families.
Wow. And can you give us some example where there was a family that, got one of these kind of not fatal, but like final diagnosis, and they felt restricted, and then they started working with you, and the children were able to, I don't know, cure or resolve some of the disabilities that they had?
Yes, I have quite a few, and I'll tell you what, I have one example that I didn't know if I would be able to help because of I observed a child in school, and the school invited me to work with a child, and I said, look, okay, let me come and observe what's happening. And they said, look, we've had another therapist came and said that it was not something that they could help with. So it was a child who was 4.5 years old, completely nonverbal, completely not able to understand and communicate, and he was not aware of what was happening around him. And it was the school who took initiative to do something with, because the parents had their own struggles, and it was decided that it has to be done for school. And I was really worried that, that was some time ago, and I thought, will I really be able to do something here? Because he's already 4.5, and it was the most difficult case I have seen. And he was diagnosed, and he had a special educational plan put in place. But the strategies that were put in place that they usually suggest for these children, they were not working. For example, one of the things was for him to use cards for communication with little pictures of things. Like if he wants a drink, he can show a card with a drink. If he needs a toilet, he shows a card with a toilet. But with him, it did not work because he didn't understand what the cards were for. He was, when I observed him, I thought this child is at about maybe between 6 and 9 months old level of understanding.
Wow.
And awareness, very poor, right? So it was very difficult to even teach him to use those cards because he didn't understand what they were for. He didn't even look at them. And everybody had a very difficult time. And the other thing that was a very big struggle was a toileting issue that he just was not aware. So he was still in nappies, and obviously it's not great at that age.
Yeah.
Yes. So, but we had no choice but to try and start unraveling everything little by little. And after a few weeks, things started shifting slowly. And when I came to observe him at one point, it was a year later. I must note that this work is not something that happens overnight. You have to put a lot of work consistently over a period of time. And in a year, he was a very different child. The only thing he could not do still, he has not yet had speech. But compared from where we started, he could explain, he could understand what was happening. He understood all the instructions, which was not the case at all before. He just was completely unaware that somebody was even speaking to him. And he was able to understand instructions, to understand what is happening and what is going to happen next. When the teacher would say, now we're going to go to a different room and do this task. And he would even show that he was not pleased about that. He would make a face. And the only thing he didn't do is speak. He was able to use those picture exchange cards to explain that he needed to go to the toilet. And that was on the playground. He came up to the teaching assistant and was trying to gesture that he wanted to go in. And she said, look, it's not the time to go there yet. We're still on a break. And he was not happy with the answer. So he came back with the card and showed a picture of a toilet.
Oh.
And she said, okay. And then she wanted to take him through one door and he wanted to go through a different one. So it was like he was trying to explain to go not through that one, but through the other one. And all of that was happening there and then. It was really, even for me, it was surprising that I was really seeing that at the time. And yes, and he went to the toilet, closed the door behind himself, did what he needed to do, then came out, washed his hands, and there was no issue. He did not need support, and he certainly didn't need somebody to change the nappies because he was out of nappies by then. That was huge. But even better, that he actually had a friend who he was pleased to see, and he was pleased to share the toy. Again, he still didn't speak, but everything else, the things that ideally should be in place before speech develops, they were there. So that was
a good trend.
That was huge. Yes. So, and I thought that if something like that can change in just a space of less than a year, it was a dramatic change, then, everything is possible.
Yeah.
The other one I have is I had a very worried mom. I did a talk in somebody's group at some point about development and neuroplasticity, and I had lots of people asking me questions, and some of the people I then started working with, and it was a 2.5-year-old who was on a pathway to diagnosis, like parents were going through the process, and he was not able to understand what was going on. He was detached and disconnected, and his mom said, "Look, where is this going?" It was her second child, and she said it's a completely different story from what I thought. Suddenly everything is just going wrong and it's not happening. And we are dealing with severe meltdowns, and that is probably for parents the scariest thing. When your child is absolutely throwing themselves on the floor and screaming and banging their head, and it is scary, and there is nothing you can do. You try to comfort them, but for them it is even more overwhelmed, and it can make it worse. So as a parent, you feel like you can't even comfort your child. What do you do? And it's massively stressful for parents. And we turned that around. We turned that around gradually. There were things that, as I say, sometimes you see little changes that you think, oh, did it really happen, or have I imagined that? And then they become more consistent. And, and then you have more and more different things falling into place. And yes, that was, I think it was just a few months that it was already different. And then gradually, I think overall I probably worked with them for 18 months or so, that it changed so much that not only was he able to repeat the words that he heard, but he was actually able to initiate a conversation and tell his parents how he was feeling. He would use words like happy, and he had his birthday party, and he understood that it was his birthday party. He was celebrating. He was he was excited about his cake. So it is things like that a lot of people who have a child who is struggling, they say, well, my child doesn't understand this. This is very sad, because they can't understand that it is Christmas or it is birthday. And for this family, it was one of those things that we could see that things changed considerably, well, completely, really. So yes, and I mean, I have lots of stories, you know. The other one I would say, when people say that, oh, but it's genetic, but it's not. We still have not found a gene that.
Okay, so it's...
Yes, there can be some predisposition, and yes, neurological, neurodiversity tends to run in families, but nothing is ever set in stone. Absolutely nothing.
Just like when patients tell me that, obesity runs in my family, but I have like, it's also lifestyle is a major factor of, like, they don't understand that genetics is maybe like 30%, but you can overcome genetics. I know hundreds of people that they're usually, like, they don't understand their household ate a certain way. So that's why you can say, oh, it's genetic. My parents are overweight and my grandparents are overweight, but you can be the one who changes your environment and changes your lifestyle.
Yes.
And then they change their life, and then their children will change. So genes aren't even if something is genetic, what you're saying, autism isn't even genetic. That's also not an excuse to just like accept it and not do anything about it.
Well, I think that's the thing. For most people, probably it's very difficult to see their child struggling and say, well, that's just how it is. You know, how is that the right thing? I don't agree with that.
Yeah.
Like, children don't have to struggle, because if not everything, there are maybe things that are not so easy to change, but that doesn't mean that we should not try.
Right. I totally
doesn't
agree.
It might mean that we need more time, we need more effort, we need to look at different ways as to what we can do. But I think to not even try and just say, well, okay, yeah. I do see that sometimes people say, well, it is what it is. But is it really? What is it? Our personality doesn't form until maybe we're 25, and even then we change throughout life, right? And yes, there is, like they say, this is how they're wired. But how you're wired always changes depending on what's happening in your environment, and that's what neuroplasticity is about, right? So it's important to keep that in mind.
And just so people are clear, you don't mean any like medications, because again, you said you're not a doctor or medical profession. You do all of this through like methods, like exercises and things of that sort.
Yes. What I do is that I look at early development, because after conception, when the baby is developing in utero, they are following a certain program that is predetermined in us as a species, right? And then when it is the birth process, there are certain things happen that when the baby is born, it needs to go through the birth canal, and there are certain movements that it has to do, and then it starts developing as an infant in the first year, and sometimes something happens that influences that development and sets it off track, right?
Right.
And if we look at how it is happening in the sort of normal circumstances, when everything works well and there is no adverse events or anything like that, if we look at that and go back to that early development and help the child to fill in those gaps that maybe they have missed on something somewhere, right? Then we can improve on most things, really.
Right. Just fill in those gaps that were missed. Like sometimes you got to go back. And
yes,
right.
Yes, exactly that. Some of the things, and there has been some research that I was looking at some point, that they looked at the children who were later diagnosed. And they noticed that a huge percentage of them had some abnormal crawling patterns, right? Like they would have one leg dragging behind them. And what we know is that when the baby is going through all those various movements, like they learn to lift their head, to pull themselves up, to turn, to crawl, to sit up, all those things, it's not that they just learning to move. They're actually wiring their brain for learning at the same time, right? So if something went, maybe there was a little gap somewhere, it can affect the whole development, how the neural pathways develop. So if we go back to that and explore that, then we can improve on many things.
Wow, I love that. And can you explain to the audience like a little bit about how you came to discover this, like your personal background when we first met? Because how did you come to this realization? That's what I mean.
Yes, I definitely didn't wake up one day and decided to do this work, right? Because I used to work as a teacher, and I have relevant education and teaching, and then I did another degree in psychology, and then I had a child who had speech and communication delays and all various other difficulties that were pointing that we would be following that pathway. It was actually that word neuroplasticity that was on my mind, because I thought, hang on, I don't understand why there is why is it determined that there is nothing you can do? Is that really so? And so I started looking at separate things as how speech develops, how communication develops, what it is, and it's not something that like you press a button and it appears, right? There are things that have to be in place, and I've been through quite a lot of various books and articles and all sorts of things, and there were all sorts of other things that maybe were not helpful, like how you should try a different diet and remove gluten and things like that. And that it still goes around, that it's all about giving your child special vitamins and looking for like magic bullet and some magic remedy that is supposed to help. But things started changing when I've come across a book that was talking about how to be able to learn. We have to have the pathways created for it first, and how they are created during early development. And then it was my aha moment. I started looking more into that.
Can you mention the name of the book if you remember?
Yes, absolutely. It's Carla Hannaford. And the book is called Why Learning is Not in Your Head. Oh gosh, I forget, something to do with movement, but it says why learning is not in your head. And for me, for somebody who always liked academia, suddenly to read that learning is actually not all in your head, that was something very new at the time. And yes, and I then started looking into that, and I found various programs that use movement to improve on our neurological setup. And then things started changing. I then started helping other people, but just because somebody will say, oh, what did you do? like one mom to another mom. And I realized that
they noticed the change in your son, like the progress that he...
Yes, because we didn't need any more of, special support or anything like that. And yes, that was noticeable. And I started helping other parents as a hobby. And yeah, it kind of evolved from there. And, the other important thing is one part of my work is the movement program. The other is auditory processing, how we process sounds. I use them together. There is a great auditory program that I use for that. And but the most important thing is actually how the mom is feeling as a parent, right? So I started helping children, but I quickly realized that if the mom herself is feeling always stressed and anxious and like a failing parent, right? It affects how much the progress the child will make. So I've completely overhauled what I did, and I now start working with the parent first. And I understand that everybody wants to help the child, but it's not like we are not doing therapy on the child, right? So if that's what somebody is asking for, I'm not the right person,
right?
Because how the parents, especially the mom, is feeling about being able to help her child. I used to think it's 50% of success, but it's probably 90, right? Because the parent, our children are connected to us certainly at a very early age, and it is so important for the mom to be in a calm, grounded state. And of course, when you're struggling with your child who is melting down,
right? That makes
all
so
the
much
time.
sense.
Yeah.
Yeah, it's such a holistic approach.
Yes. Yeah.
And it makes, it totally makes sense that this will make it more successful instead of, because I've heard the same approach from parenting coaches, for example, where sometimes the parents come to the coach and they only want to focus, like, how do I get my child to do this and this and that? And then they're like, okay, let's take it back and let's see how you react to stimuli and how you, like, manage your anger and emotions, and then it will work on the child. So, and that makes sense to me, like, because the parent is, like, especially the primary caregiver, the mom, she has to make the child feel safe, because if he doesn't feel safe and secure, it'll probably hurt his progression. Yeah, so that totally makes sense.
Yes, and I realized that I give parents exercises to do with their children. I say, look, let's start with a simple hand massage, maybe feet massage, but the problem is that most of the children who need this help, they're not going to allow you to do anything like that with them, right? They are going to take their hands off, and they have sensitive feet. They're going to withdraw them, and they're going to start screaming. And what do you do? And I can see why a lot of parents, they go to see, like, maybe an occupational therapist or somebody else would give them a recommendation to do something like that. And they can't do it. So they say, well, my child doesn't want it. And what do? We give up, right? Because it doesn't work. But I found that the more the more a child avoids a particular technique, the more they need it. That's because the pathway is not formed. So, of course, you touch their hand and their whole body goes into an overdrive. They don't like it, but they need this work. So we have to first make sure that the mom feels confident enough and not as a failure that she tried it so many times and it didn't happen, that we can try again and maybe a little bit at a time and not feel like we're passing some kind of exam. And then suddenly it starts happening. So suddenly we can do this work with a child, and then it opens up other opportunities. We then can do more. But if the mom is not feeling that she can actually do it, that, oh my goodness, what will happen? She doesn't like it. She wouldn't allow me to touch her, right? What? How can I do this exercise? It's impossible, right? Which is why it's first of all, it's important that the parent is feeling grounded and confident, right? Which is why there is a lot of support is necessary in something like that.
Yeah. And to parents out there, well, can you tell me, when is autism usually diagnosed?
I think it depends in different countries. They do it, maybe it depends on the system, but I know that in the UK, for example, people have to wait for years.
No, well.
They have long waiting lists, and the problem is that in those 2 years that somebody's on the waiting list, if they got help, they would have been in a much better place by the time their appointment happens, right? Because
2 years, a lot of delays can happen during that.
Yes, because if we'd looked at it differently, because what happens, they say, well, let's wait till this child is maybe 3-4 years old, and then social difficulties will become apparent. And then we can diagnose, right? But there are so many things that I personally don't agree. That what is this family supposed to do during those 2-3 years that they're on the waiting list, right? And this time in the early development is very valuable, because it is much easier to help a child earlier on than wait till they've already established some patterns to compensate for the challenges. And then we have to unlearn what they have learned and try to change that. It's much easier to start earlier on, because then not as much is established, right?
So, yeah, that makes sense. And from your experience, since it can take, at least 2 years in some countries to get a diagnosis.
Yeah.
And I know this is an official diagnosis, but just from your experience, what are some telltale signs that parents can look out for that maybe should, raise some red flags that maybe their child is on the spectrum?
I think there is in official tests, there are sort of things that you choose from social development, from communication, from emotional aspect. I think most often it is that the child does not respond, that they seem disconnected. Not all children seem disconnected. There is this perception that it should be a sort of sad-looking child sitting in the corner. It's not always the case. There are a lot of children who get diagnosed who are quite smiley and can even seem outgoing. There are repetitive patterns that people talk about, that a child may be repeating a phrase or some movement all the time, or they like can spin around in circles or maybe run from one end of the room to the other. There are lots of things, but there is the whole test where parents answer questions. But what seems to be overlooked in all of that is that the diagnosis is always observational. There is no medical test, right? Like, if you have, say, bronchitis or pneumonia, you can do a blood test, right? You can do X-ray, yes, and it will be obvious that definitely this is what's happening because we found this.
So there's no such thing for autism?
No, there isn't. There isn't. And that is something that seems to be overlooked. But if there isn't a definite answer to that, and this explains the confusion that a mom takes her child for a diagnosis to one specialist and they say yes. And the other one says no. No, I don't think so. Look, they're smiling. And, there are all sorts of stories, right? How people are fighting for a diagnosis to get help for their child. But different specialists can show different opinions, which is why they then have a panel and people discuss if they should give a label to this or that child, right? Or it could be a lot of parents I know struggle that the child behaves differently at home from, say, school, right? And there is a lot of misunderstanding because of that, because school says, no, we don't have any problem with this child. Parents say, no, but we do at home. So what's going on?
So what does that discrepancy come from?
That's, again, because it's an observational and subjective, in a way, diagnosis, right? Because there is no definite medical answer to that, but it is overlooked. And for me, if there isn't anything like that, maybe we should look at, actually, instead of thinking what it should be called, we should look at how to address the struggle, right? Because then what happens in our country is often the case is that eventually parents do receive diagnosis for their child. They feel that their concerns have been validated, that they were not just an anxious mom who invented a problem, right? Because people do quite often feel like that. But then they're sent away with a leaflet. Getting diagnosis doesn't always mean that they get support for their child. And then it's another fight for support, right? So it is how things operate in slight differences in different countries, but they're not always working out the best for an individual child. A lot of children get lost in that system and are not being helped.
So when a parent has a suspicion that their child might have autism or be on the spectrum, what is the first thing that you think they should do? Should they hurry up and try to put pressure to get the label, to get the diagnosis? Or should they be seeking could they work with someone like you before they get the diagnosis? Or do you need that diagnosis to know?
I think, to me personally, because I am not a medical specialist, to me personally, I would say it depends on what outcome they want to achieve, right? There is always a choice. And I think my main message is it doesn't have to be that how it is determined that the child gets diagnosed and they have to struggle, because I don't believe in that. I believe that every child has potential to improve if they get the help that they need. Okay? So from that point of view, I think to get support in school and everywhere, you probably have to go through the system and follow the, how things operate in a particular country. But for me personally, it worked to be a bit of a rebel and not to listen to that, because I was focused on how to help my child now. Because we had an appointment in 6 months, then another 6 months, and by the time it was a review 18 months later, our pediatrician was very surprised that she said, "Oh, I remember you. What happened?" Because this is a whole different story. And I thought that she would be very interested to know exactly what we did and what we worked on and how. But no, she said, "Okay, I will discharge you."
Yeah.
Right? So there are different options there. And I think you can probably do both. You can find your place in the system and work with somebody to address the difficulties at the same time. And you might even find that by the time your appointment came, things have improved considerably. You can wait and see. I think that is probably the worst advice I could give anybody, is wait and see. But it's the most frequent one.
Mm-hmm.
Right? Because
You're the second one who said that on my podcast. Wait and see is the worst advice.
Yes.
You can watch that episode with Gabrielle. She also said, wait and see is the worst. Go to get a second opinion if someone tells you to wait and see.
Yes, absolutely. I think that is the worst advice anybody could receive. But the problem is, because we listen to the authorities, that we go for advice to people who we believe to be experts in what they do. And they say, well, don't be so anxious. It's okay. Everybody's doing their things at their own time. But how long are you supposed to wait?
Oh, speaking of that, have you heard that this is in America, that they kind of lowered the milestone? Well, they raised the age of different milestones for like speech and walking and things like that. What is your opinion on that? Do you think that's a positive or a negative? Or
I think perhaps there is a little degree of flexibility, but we must not forget that as a species, we have a predetermined program that we should develop. Right? Like when a child is supposed to sit up, to crawl, to walk, and if that is not happening, then we have to look as to why. Maybe there is something not quite in place. Because then it's like a domino effect.
Right. That's what I was wondering. I was wondering if that would make people, if they do have some developmental disorder, will that delay their diagnosis because like you're waiting to see even longer?
Yes, you're waiting to see even longer, but the problem is that you're losing valuable time. And although it is possible to improve things at any age, sometimes I hear parents say, "Oh, but I've heard that if a child is 5 and still not talking, then they will never talk." But that might not be true. But there is that panic that, oh, my child is already this age and still not doing something, right? But I think the best advice I could give to somebody is that if you are feeling that something is not right, your mom's instinct is the best advisor in the world. If you are feeling something is not right, because a lot of moms say, my child was different as a baby, I could tell something was different. Right? And knowing what I know now, you can tell that if a baby is not responding, it might be because there is something that needs to be addressed already at that kind of infancy age, right? We don't need to wait until they're 3 years old to see how they are going to be interacting with people.
Right.
Right? Because if they are reacting to the sound of light switch, but not to their mom's voice, that could indicate that there is a problem with sound processing. And you can start looking at it and helping them. And by the time they are 3 years old, they won't have that issue. But if we're waiting until they're 3 to see that, this child doesn't like playing with other children, then, because you see, we are so focused on the social that we forget that for social functioning, we need to have the right physiological basis in place, right? All the like sensory processing has to be working well enough for us to then be able to communicate and function as a social being.
Wow. Well, Svetlana, I could talk to you for hours, but you dropped so many gems, so much valuable information. One thing is for parents out there to listen to our instincts. Mama's instincts knows our best.
Yes, mom's instinct. And we do get a lot of, if you feel this gaslighting by professionals, they say, oh, you're just being anxious. You're just being anxious. Just wait. But you feel that, no, this is not right. You are the one who knows your child the best.
Yes. And that comes
always
to be true
remember
times
that.
and times again. I know so many anecdotes and stories of moms too who've been on this podcast where the doctor would tell them one thing and then later on they would find out the doctor was wrong. So I think you have, of course, medical professionals have their place, but I think a mom also, we should listen to our hunch. If something doesn't feel right, then continue to investigate and maybe get a second or third opinion.
Yes, absolutely.
I really love your approach, the neuroplasticity approach to treating autism and not accepting it as like a final verdict. You can work things through and the child can live a normal life. And I've heard stories like this too, where children that were given all types of like diagnosis and you'll never do this, never do that. They graduated high school and went to college. So
the best thing is that when you see that your child is making progress and, that your child doesn't struggle, that's the aim, right? That's, I think, what everybody wants to achieve is to,
living to as close as a normal life.
Yes, to have a normal life.
Right.
Yes, to the best of your ability, right? To be able to go on holiday, to be able to do things together, to not worry about having a meltdown in a supermarket and, have all the looks at you from people like, can't you have your child under control, right? Like you have to explain yourself that.
Yeah, that's a whole other topic.
Yes, absolutely.
Accepting, the judgment from other people.
Yes.
Thank you so much, Svetlana. Could you tell them, my audience, where can they connect with you? Where can they find you?
They can find me on Facebook. I think that's my place where I, can be found. I have a website as well, which is SvetlanaRobertson.com. That if anybody wants to get in touch, they can.
Great. I'll make sure everything is linked.
Yes. And, I'd like people to know that now with our technology and everything, a lot can be done online. I work with a lot of people from different countries because Zoom is wonderful. You can do quite a lot. And you don't have to, come to England to see me. It's, it's possible I can help you online as well. So, yeah.
Wonderful. Well, thank you so much, Svetlana. This was an absolute pleasure. Thank you for sharing your wisdom with us.
Thank you for having me.
Thank you. Bye-bye.
Bye-bye.
And it's a ticket talking Mazda for the biggest. That's a comma and a comma and a comma. Gotta get it.
And it's a ticket talking Mazda for the biggest. That's a comma and